Welcome to our series of healthcare scene interviews where we sit down with top leaders in healthcare IT. I'm John Lynn, the founder of healthcarescene.com, a network of leading healthcare IT resources and blogs. We have a career site. We even have a conference in 3 weeks doing marketing and PR, so check that out at hitmc.com. But today I'm happy to host a man with a really unique vision for healthcare, and a deep experience, and really a desire to make healthcare better, Alan Portela. But before we get to Alan, I want to begin with a few notes for those watching live that aren't familiar with the Blab platform. We'll talk for about 30 to 40 minutes, and then we'll open it up for questions from the audience and comments, so you're happy to hop on after about 30 minutes. Also, if you're watching live and you like what someone's saying, feel free to click on their face. Or if you just like that person, you're welcome to give them props like that as well. Also, on the left-hand side, there's a button there you can tweet and share what's being said, so do that. Also, if you're watching live and you have any questions during it, you can also type /Q space and any questions, and assuming it fits within the flow, we'll try to answer it during the conversation. If there's not time, we'll get to that afterwards in the after party. We call it the after party. So without further ado, I want to welcome my friend, Alan Portela, CEO of AirStrip. Welcome, Alan.
Thank you so much. Thank you for having me on your program.
Thanks. So, Alan, for those that don't know your background, tell us a little bit about who you are and your experience in healthcare.
Well, my name is Alan Portela, CEO at AirStrip. I have been in healthcare for over 2 decades. Actually, I was remembering this year at HIMSS. It was my 23rd HIMSS. Wow. So it's been a long time. So I have, sorry?
It's changed a little bit over those years, I think.
Just a little bit. At least the theme is always a number of vendors claiming a number of things that they don't do. That has not changed in 23 years. I have been in healthcare for almost 2 decades. I have been the CEO at AirStrip for a little bit over 5 years and enjoy the ride.
Excellent. So I think that's a good place to start, because I'm sure that many that watching live or watch the recorded version don't know the history of AirStrip. So can you kind of give us a brief history of AirStrip and the work you've been doing streaming healthcare data to mobile devices?
Perfect. Yeah. So we at AirStrip, we started over a decade ago, and we started mobilizing medical devices, specifically in obstetrics. And we are proud to say that today, 1 out of every 6 babies born in the U.S., the moms are actually monitored by doctors using AirStrip mobile applications during labor. So basically, what we did is connected real time to fetal surveillance, fetal heart rate, maternal contractions. So now the doctors could monitor those babies remotely. And about 4 years ago, we also introduced the ability to connect to EKGs in ambulance from defibrillators, also a real-time patient monitoring in intensive care units. And I think that we became very popular 4 or 5 years ago when we were starting to demonstrate that we were accelerating time to intervention for patients coming in an ambulance with a full blockage of the artery, what is called a STEMI. We got a lot of publicity because we started really moving from what was 90 minutes, what is called door-to-balloon time from the emergency department to the cath lab, in some cases doing 30 minutes from event to balloon time, event being the time that the ambulance picked up the patient. So as we evolved as a company in mobilizing medical devices, and we were the first ones doing it with a 510K Class 2 FDA clearance, so that means that we display the data with diagnostic quality. As we evolve as a company, we recognize that what we need to do is really impact workflow. And caregiver workflow, you don't impact just by showing the data from medical devices, but you need to look at contextual data that comes from electronic health records, imaging, video, and other data sources.
And I know we're going to dive into a number of these areas, but I still remember one of the first times we met, and you were telling me kind of this history of starting with the neonatal stuff, and then kind of from there going to the the cardiology data. And then I remember something specifically you said. You said, it turns out that's much harder than you would think, especially to do it at diagnostic quality, right? I mean, so as an untrained person, it's just a line going up and down. Like, why is that so hard, right? I think that's what many people say. Or, I had one person say, well, can't you just scan it and attach it? That's just an attachment, right? But I remember you said to do it at diagnostic quality, which, I know you guys have gone through FDA clearance for a number of your solutions. That is much harder than just scanning, or having a line go up and down. Is that right?
Yeah, thank you for the question. So if you think about it, it's not just the issue of performance on how you run the application in a way that you get a sub-second response time, so you are really getting data near real-time basis so you can support the moment of care. But also is how can you display that waveform in a way that as the doctors use the native tools of each mobile operating system and they zoom in into that waveform, that the medical aspect ratio algorithms are kept in a way that you do not lose the diagnostic quality. So this is very important as we know that we're moving into a patient-centric model outside of the four walls of the hospital, and we have a shortage of caregivers and more patients coming into the system. Showing data with diagnostic quality when you have few caregivers looking at all those patients outside of the hospital is going to be crucial, because you want those caregivers to really look at the data with the best possible quality. The other aspect of performance is the ability to run the application natively on the mobile device. What that means is that your app runs on the mobile device and you're only moving zeros and ones throughout the network. That is much less bandwidth that is required, and that's how you can keep the right performance level. And of course, the good news is that for us, since we started very early and we were the first ones doing this, we were granted a patent on mobilizing medical devices, re-rendering medical devices on mobile devices natively. So we are definitely the leader in the world in this area.
Well, and I think you had an interesting inflection point for what you were working on when AirStrip was on stage at the Apple Watch announcement event. I am sure some people would say, what was AirStrip 1 doing now Apple Watch, since you're an enterprise solution, and Apple is generally more of a consumer focus. But I think so. It's great exposure, I imagine, to be on the Apple Watch stage. So tell us about that integration with the Apple Watch and what you're doing there. I know you guys use the Sense for Baby technology there. So tell us about that.
Well, first I have to say that the inflection point, I think it was more for Apple than us.
Looks like we lost connection, but we're back with Alan Portela, CEO of AirStrip. And we were talking a little bit about the announcement that Alan and AirStrip made during the Apple Watch announcement, where they demonstrated some of the amazing technology they've been working on. And I think Alan aptly pointed out that the inflection point was likely for Apple more than it was for AirStrip. I mean, you've been doing it for 7 years by that point or something. So you'd kind of already been doing the technology. But I think it was a nice moment to show, that you could do it with Watch. You could stream that to any application. You can maybe take it off from there. And what did you think about the announcement?
Well, I think that what I was saying earlier is that this was a good validation of what we have done so far and the role that we play in the industry moving forward. And if we look at the specific use case of that presentation, it was about a mom being at home that is a high-risk pregnancy and using a non-invasive field monitor to be able to stream data directly either to the Apple Watch or the iPhone, and that data going to the doctors with diagnostic quality, and the doctor being able to perform a non-stress test remotely and being able to tell the mom immediately, either by a phone call or using the notification tools of the Apple Watch, that everything is okay, or that eventually a follow-up visit is required. So that type of work It's going to be the next generation of monitoring patients outside of the hospital. It's technology that already exists, the capabilities we do today.
Is it FDA cleared?
Well, so what happens is when I was mentioning the use case, you use those devices just to stream the data. There are no doctors that will like to look at waveforms on an Apple Watch when they have the iPhone right next to it with diagnostic quality. We will not even attempt to go through the FDA clearance process for a phone when we feel that's not the right device to display the waveforms.
You mean with a watch, right?
For the Apple Watch, yeah, I'm sorry.
Yeah, so that makes sense. And I think what's interesting is that you're riding the line between, because that is a very consumer-focused product where you're able to really touch the pregnant mother in that situation. But, obviously that was likely facilitated by the doctor who says you're high risk, I need to monitor you, here's the application. But it's interesting, you're kind of edging that line of almost becoming a consumer product. Is that in the future of AirStrip, or where you go straight to consumer, or do you think you'll always go through the provider?
Well, so it's very interesting because what you saw there is something similar that we're now doing, looking into cardiology to be able to send patients home with patches that give you 1 or 2 leads of an EKG. We are looking into doing the same thing for diabetes, with glucose patches, being able to send the data using Bluetooth or a near field connectivity, the same way to the caregivers. So up to now, AirStrip has always been a silent partner to the patient. Basically, we connect to their devices and we display that data with diagnostic quality and the contextual data to the providers. So I believe that moving forward, we are going to move into the patient engagement side, but we're going to do it through partners that already are doing a very good job. We see that the future is about collaboration. It's not about trying to reinvent the wheel on things that already work, that are performed by other vendors.
Interesting. So I think it's interesting to think of AirStrip as a collaboration platform. Obviously with the basis being data coming from a variety of devices, but also connecting the right people. Interesting. So Dr. Jimmy, he asked the question, is the watch secure and considered HIPAA compliant? What's your answer to that?
Well, so the main issue here is how you manage the data as a vendor. When I was mentioning before that we are running the application on the mobile device, on the client device, and we are just sending data through the network as zeros and ones. The key is to be able to encrypt the data on the device, on the server, and during transmission. And that is actually what we are doing at AirStrip. The moment the transmission is interrupted, we do not store any data on any device. And I think that's the key of figuring out how secure the devices are. Just use them to display the data. Do not use them to store any data, because eventually all things are vulnerable.
Yeah, we've seen that. I like to say, if Google can be hacked, anyone can, right?
Exactly.
And Jimmy makes a good comparison. He said it's almost like you're using it as a thin client where no data is stored. It's just the display device.
Correct. It's a very good comparison.
Yeah. So, I think it's interesting. You started by displaying all the mobile data on phones. And I think you were even in the early smartphone days, or even pre-smartphone days, if I remember right. And then you did smartphones. And then you started, sending notifications to the watch. And I think it hit you announced something about the Apple TV, or there was some. I didn't see the news. I just saw Apple TV and AirStrip One. So tell us, what are you doing there?
Well, so let's start by saying that we are all about workflow transformation. And what we do is we analyze clinical workflows and we figure out what technologies are going to enable the transformation of that workflow. It was perfect. The perfect example was what we are doing at the Apple conference with the Apple Watch, the iPhone, the tablet. And by the way, we are agnostic to any operating system. So we run on all mobile devices, even on RIM. So So as far as the what we see on the Apple TV is it's really more as a patient engagement tool. This is something that more of the partners that we are collaborating are looking at bringing the Apple TV at home, so then the patients can use that more in order to be able to manage their health. But for us, it's another device, and we are not adding any new capability with that.
Mm. So it's just extending the display to another device. Interesting.
Exactly.
Well, I know, one of the topics that we love to talk about, and you kind of prefaced it in your opening comments about AirStrip, is that, you also looked at how do you get the EHR data and how do you stream that to a mobile device. It's something that I've been fascinated watching you as you battle this challenging approach. So tell us, where are you at today in streaming EHR data to mobile devices? What's your offering look like? Where are you at in the process of doing that?
Well, so as you stated during the beginning of the conversation, I was talking about the importance of monitoring medical devices, but also the importance of bringing contextual data like electronic health records. So at AirStrip, we have been extremely lucky that we work with hundreds of provider customers that are the ones that are helping us to define each of the workflows, the data requirements, and they're acting as an honest broker on a case-by-case basis between us and the legacy systems that own the data sources. They don't own the data, but they own the data sources. So what happens is every customer that we work with, once we define the workflows and we figure out what data needs to be extracted from medical devices and electronic health records, then they are the ones that navigate that challenge of negotiating with their own vendors. And some are very good, some are not so good, but negotiating with their own vendors on how to aggregate that data. They do it themselves. They expose that data, and then they use our tools to be able to display that information on a case-by-case basis. So where is that we're at? Well, the reality is that we feel that instead of doing this on a case-by-case basis with each customer going through this process and repeating that process, providers need to join forces and use their buying power to be able to become the honest brokers and enforce the interoperability moving forward. So I was very pleased to see that the Center for Medical Interoperability was created. They already have about 15 or 16 provider members that cover almost 1,000 hospitals. And now this group is putting together a very good group of providers that have multiple EHRs, multiple medical devices, and they already are engaging very actively with vendors to be able to open up the data.
Well, I think it's interesting. I think that approach that you mentioned is interesting because you're going to the customers and using the customers' buying power to move it forward. And you compare that against, the HHS secretary saying, we've gotten pledges from these vendors that they're going to be open, which, feels a little hollow. At least that's my experience. A lot of people's reaction to a pledge without any sort of commitment. I know you guys even recently signed the Patient Safety Movement's Open Data Pledge. How are all those going to work together, and how do we get to that interoperability future where data can be shared easily?
Well, first of all, I have to
the answer.
So the interesting thing here, John, is when we talk about vendors pledging to support interoperability, we have to go to the root cause of this problem, which was started by the government. The government put incentives in place, was like what we know on the Meaningful Use program, that was based around the adoption of technology, but interoperability was seriously overlooked when the incentives were provided to all the vendors. So what happens is, if you look at that model, and never looking at interoperability. And as we move into a value-based reimbursement model, clinicians are not going to have access to the data that they need in order to be able to make the right decisions. So now you look at what the government is doing moving forward, and they are talking about the standards, being able to increase the data that is shared through standards like FHIR, but also they're talking about forcing the industry to open their APIs. But the reality is, if you look at the 10-year roadmap between 2014 and 24, by the time this actually really happens, based on the roadmap from the government, is going to be too late, because we already are moving into a value-based reimbursement model. The doctors need the data now. So the vendors are pledging to open up the data following the roadmap of the ONC, which in essence is absurd. If you look at how much data is needed to support each workflow, it's not available on FHIR, and the elements that are supported today on FHIR, HL7 or CCDA.
Yeah. So I think it's, I agree that it's too slow. I think that's a really apt point that you're making as far as 10 years is too long. I think we could go over and over about the challenges, but maybe it's better to take it a direction of, okay, if this EHR data is available, I think, some of the EHR vendors make it available to you for the work you're doing. What are the opportunities once it becomes available? What are you doing with that data once it's made available?
Yeah. So the first comment that I want to make is, when we were talking about providers now getting together to really become the honest broker, I believe that 2016 is the year where the providers have the opportunity to become the honest broker. In 2017, if the providers don't do it, the patient is going to become the honest broker. They're going to be the ones deciding which healthcare organization they're going to go to based on their ability to get their data, because it's not the data for the provider, it's the patient's data. Now, as far as what is that you do with that data once the data is exposed, you know that the opportunities are just incredible. We are doing a number of projects with our customers where we're taking basically real-time data from electronic health records. They're taking data from medical devices, and they're applying algorithms to be able to early detect patient instability. All that information that we're doing right now on the acute care space is going to be very useful as we move outside of the four walls of the hospital, monitoring patients. So definitely opening up the data it's going to be crucial moving forward.
So do you have some examples of ones where you've worked on that with your customers and seen success?
Yes. So we are right now on a project working with the University of Michigan. On what we're doing there is getting data directly from medical devices, looking at the continuous waveform from a monitor that, if you look at that monitor, is the same technology that we have been using for over a decade or more. And what they're doing right now is applying algorithms to study those waveforms to be able to identify any variance in those waveforms. So they're taking 20 seconds snapshots of the waveform, and they are looking at early signs of patient decompensation due to loss of blood or plasma. This was actually done with research from the Army and the NIH. And this was done around some soldiers in Afghanistan that they're close enough to an IED explosion that a shock wave creates internal bleeding that is very hard to detect unless you apply technology like monitors, but bring algorithms to read those waveforms and tell us more things. But if you combine that to the data that comes from the EHR, looking at the latest documented vitals by the nurses, fluid balance, medications administered, that's when you really provide the next generation of what could be called precision medicine monitoring.
How close are we on some of those efforts as far as using computers, AI or other technologies to understand the waveforms or at least assist the doctor in their analysis of all that data?
Well, so if you look at what is happening in healthcare today, most of the clinical decision support tools are based on retrospective data.
Yep.
Very limited access to real-time data, almost non-existent on the medical device side. If you look at standards, the challenge that you have is that going back to meaningful use only talks about EHR interoperability now, but they don't even address medical device interoperability. There is a standard for medical devices, IHE, which most of the vendors do not support at this point. So what happens is you need to be able to move that data. You need to be able to use clinical decision support tools like real-time processing engines, analytics engines, clinical algorithms, but apply all that on real-time data. So now the caregivers can become proactive versus being reactive to adverse events. And I think it's a good example here is looking at what has been done in the intelligence community. Since 9/11, the government has developed very sophisticated tools for listening to real-time data in motion, data that has not been yet stored anywhere, like voice calls, emails, text. We don't even want to talk about the encryption and all the issues that people are talking about right now. But the tools exist to look for early warning signs of terrorist attacks. If you bring that same technology and analyze data in motion, data that is present at every home where people are connected, patients are connected to sensors, they're getting on a scale, they have activity monitors, wearable devices that are monitoring their daily activity. All the data doesn't need to be stored in a data warehouse. All you need to do is bring the right tools that can analyze the data in motion, what we call high velocity analytics, and be able to apply those algorithms to be able to make the right decisions at the right time. And again, they exist. The barrier is, again, the access to the real-time data. It's not really that we are lacking those algorithms.
That's interesting. I think there's still a lot of work to do on the algorithm. So it's interesting to say you think the algorithms are ready, but the data is just not there, at least in a real time. And I think that's a very fine point that
well, I would say phase one of the algorithms is ready.
Yeah.
This is just the beginning of that new world. So there is a lot to be developed and a lot that we need to understand.
Yeah, that's fair. It calls me back to, I heard the CMIO from Intermountain talk about, how I think they said they had 200 quality projects that they were working on that to analyze what's the best quality, what's the right workflow, what's the right, treatments, et cetera, for a patient population. And he said we probably need to do 2,000 more, but our budget doesn't allow us to. And I think that's kind of what you're hinting at, is that there's some available today, but there's thousands more that need to be developed still.
Correct. And that's why when we go back to AirStrip becoming a collaboration partner, we are working with places like University of Michigan, MedStar Healthcare, George Washington University. We're working with Cincinnati Children's and really leverage from their knowledge of the clinical use cases, the clinical conditions for all of us to figure out what are the next generation of algorithms that are needed.
Interesting. So it's been interesting now, like EHR vendors have taken kind of the opposite approach of AirStrip. It seems like where they've been super slow to adopt mobile. And obviously some of it is historical because they've been around for so long and they were around before mobile. And so you're kind of in a unique position where you could go mobile first in kind of your approach. But what's taken EHR vendors so long to embrace mobile? And why have they left you such an opportunity to do this on mobile? Why haven't EHR vendors done this?
Well, keep in mind that we want to be viewed as a company that collaborates with EHR vendors. It's not that I'm really going after a gap that they are leaving by not implementing mobile technology. I believe that all of them have done a very good job creating apps to mobilize their solutions. The challenge is that today we are living in an industry that is consolidating and collaborating more and more. In every region in the country, you see a number of healthcare providers collaborating. And what that means is that you're going to deal with other organizations that have different medical devices, that they have different EHRs. And if you look at a healthcare provider that has 100 hospitals and 300 clinics collaborating in each of those regions where they're at with other providers, you probably deal with hundreds of medical devices, hundreds combinations of EHRs. And the reality is that if a physician trying to access patient data uses every EHR's mobile application one at a time to look at the patient data, basically what we're doing is apping doctors to death. They will have to open hundreds of applications. What we do is really bring all clinically relevant data from multiple systems, multiple environments into one view. And of course, at some point, we hope that the vendors expose their APIs. So on the same platform, you could actually click on that API and enter an order in a physician order on one of those electronic health records without the user having to get out of one application. So the reality is you need one app, you need one application and one platform to be able to access the data that you need.
I'm reminded of one of the first things you ever told me, that you said the EHR world will be a heterogeneous environment. It seems like we could extend that to the data sources will be heterogeneous, the medical devices will be heterogeneous, and you're suggesting that we need a framework of an application that will bring that heterogeneous data sources, medical devices, which I guess are data sources as well, into one view to make it efficient for the doctor.
Yeah, if you look at the wave of power over the last 2 decades in healthcare, in the 90s, it was really controlled by the medical device companies. After Y2K, electronic health records became the powerhouses and the biggest partners for healthcare organizations. If we look at where we are today, with all the changes, Affordable Care Act, more patients coming in, fewer doctors, this is the time where the future is about agnostic vendors that can aggregate the data, can normalize data, can analyze that data, and visualize it the right way for the caregivers to be able to make the right decisions. So it's hard for a vendor that has an EHR or a medical device to come in and become
agnostic
to be able to get data out of the other competing EHR vendors. So what we want to do is, where you see an organization that is centered around one EHR vendor, what we do at AirStrip is we bring medical device connectivity. But when you see multiple systems in play, that's when we really bring the huge benefits of what we have to provide on interoperability.
And it calls back to your comments about needing to do that in real time. I think what you described was the EDW, right? The Enterprise Data Warehouse of the past, but that was still historical and wasn't very actionable. So, I think we need to do it real time to the mobile device in a really actionable way.
Definitely.
Excellent. Well, we're up against the clock for the formal interview, so I'll just wrap this up real quick. I want to thank our guest, Alan Portela, CEO of AirStrip, for joining me to talk about really real-time, near real-time at least, patient data in and out of the hospital. If you want to check out more of these videos, you can check them out at healthcarescene.com and the Healthcare Scene channel on YouTube. So check it out there. Thanks for joining me, Alan.
Thank you so much.